morning, all. Mr. President, you had us all waiting here for a while, and I was sitting in the corner there just being anxious, waiting your arrival. Thank you for being here this morning. Honorable President of the Cooperative Republic of Guyana, Dr. Mohamed Irfan Ali, Minister of Health, Dr. Frank Anthony, Minister of Culture, Youth and Sports, Honorable Charles Ramsden Jr., Minister of Human Services and Social Security, Honorable Vidya Prasad, CEO of Georgetown Public Hospital, Mr. Robbie Rambaran, Director of Medical and Professional Services, Dr. Navindranath Rambaran, members of the GPHC Board of Directors, directors of GPHC, councillors of the Kitty and Campbellville constituencies, Mr. Stephen Jacobs and Mr. Pagu Singh, members of the 20th Chinese Medical Brigade, staff of GPHC, and by extension, the Campbellville and Kitty Health Centers, esteemed officials, special invitees, members of the medical fraternity, and dear residents of Campbellville and Kitty, it is indeed a pleasure to welcome you to this significant occasion, the sod-turning ceremony of the new Campbellville Polyclinic. Healthcare is a pillar of national development, and today we witness yet another remarkable step.
Her Excellency President of the Cooperative Republic of Guyana, Dr. Mohamed Irfan Ali, Honorable Minister of Health, Dr. Frank Anthony, Cabinet Minister, Dr. Charles Ramsden, Mr. Charles Ramsden, and Dr. Vindya Prasad, colleagues of GPHC and MOH, Councilor of the Kitty and Campbellville constituency, head of the Campbellville Clinic and Kitty, members of the Chinese Medical Brigade, Board of Directors, special invitees, members of the media. A pleasant good morning, glorious sunshine and a lovely breeze. Mr. President, 25 years ago, when I migrated from the Essequibo Coast to Georgetown, this is the community I reside in. I live 5 minutes from here. This clinic is where my mom, my aunts, my uncles, my friends, and my neighbors attend. So this is personal to me. And I want to thank you for greenlighting this project. I also wish to acknowledge Ms. Karen Brown, who I inadvertently missed. She's the Postmaster General, and the staff of the post office, who we had some very tight negotiations with when it comes to the demolition of the Campbellville post office and utilization of that piece of land. It's been a while I have been researching to find out where in the world offers specialized healthcare services free of cost as those that we offer at the Georgetown Hospital. And then I decided to start a look at developing countries and developed countries and their GDP, and it compares it to the investment of healthcare as we do. And I honestly can't find any. So therefore, we have a lot to be proud of what is happening in the health sector. Mr. President, I thank you for that leadership. Today, I'm delighted and excited about this milestone in our journey to enhance healthcare for our community and by extension our country. This sod-turning ceremony for a modern polyclinic, we take the first step towards building a facility that will improve access to quality care and serve as a beacon of hope and well-being for the generations to come. And as I made these notes last night, I was explaining to my son what I have to do today. And he wanted to know what do I mean by a sun turning. And he said he wants to be here with me. He actually brought his little spade and a bucket. I thought he was going to a resort on the beach. And then Marcy earlier asked him, you would have preferred to be at home today playing your video game. And he said, no, I wanted to be here. So I am proud. And when we speak about the generation and the footprints that we want to leave, we leave it for the next generation, our children and our children's children. This new polyclinic represents more than just a building. It embodies our commitment to meet the evolving healthcare needs of this community. Once completed, this facility will provide comprehensive medical services, improve efficiencies, and bring critical healthcare closer to the people we serve. It will be a place where innovations meet compassion, a space that reflects President Ali's vision for a world-class healthcare system, focusing on accessibility, patient-centered care. In November of 2010, we took over the Kitty Health Center, and then in February of 2012, we took over the management of the Campbellville Health Center. At the time, these facilities saw less than 100 patients per month, respectively. At present, the Campbellville Health Center is seeing an average of 2,334 patients, and the Campbellville Health Center is seeing 2,752 patients per month. That gives us a total aggregate average patient of 5,077 per month. And I want to mention as well, in 2022, we took over the management of the Festival City Health Center. And when we took it over, their average number of patients seen at that facility was 163. Now we are seeing over 2,000 patients per month at that facility. And that facility very soon will be upgraded to a polyclinic. Actually, it is upgraded to a polyclinic. But why we haven't changed the sign to say it's a polyclinic? Because we have an X-ray machine that is already a brand new X-ray machine that is installed, and all we are waiting on the UPS to commission that. And because of those types of service that we are bringing closer to the community, we are seeing the increase of the patient at those facilities. And very soon, in about 4 to 5 months, we will be doing similarly what we are doing here today at the Industry Health Center. That is already a commitment in the 2025 budget. And I have also asked the Minister for Sophia Health Center. So when I said I have a favor to ask you one day last week, and he said, what is that? And his facial expression changed. He probably thought I wanted a raise in salary or something. And I said I wanted Sophia Health Center, and he started to laugh. And I said, yes, I know, I come to you asking for work, because I did ask for Festival City Health Center, I did ask for the industry and the infectious disease hospital, because I see a broad picture, a strategy that we aligned all our services together with those in the catchment area of Georgetown, because Georgetown Hospital also is a community hospital. Establishing this modern polyclinic is a long overdue response to our challenges with the existing facilities. Both the Kitty Health Center and the Campbellville Health Center have served their community, but they were limited by outdated infrastructure. At the Campbellville Health Center, there were several ad hoc extensions to the building And even some of the roofs, the elevations were higher than others. And when it rained, the entire building floods. There was sewage overflowing, and also there was improper, poor patient flow within the clinic of itself. So it was really in a bad state. At Kitty, that's a private property, a house that we are renting. It has a very steep step, narrow, and it's very difficult for those patients, especially some who are really immobile, to get up to the upper floor. So these spaces are designed to improve healthcare delivery. We have been confident in the dedication and skills of our healthcare professionals at both facilities. We understand the challenges that they have faced in providing the highest level of care with the constraints of outdated infrastructure. We also know how frustrating it can be when you have knowledge and passion to serve, but limited resources hold you back. This facility will change that by providing our team with the right tools and environment. We are now improving service delivery, but also boosting morals and enhancing job satisfaction. This new facility will bring together Kitty and Campbellville under one roof in a modern, well-equipped space that enhances the patient experience and improves service delivery. It will be a two-story building, approximately 12,693 square foot per floor, level utilizing the compound that is adjoining that right here where the Campbellville Post Office was. A section of the building is also allocated for the post office use of 1,300 square foot, inclusive of the postmaster's office, filing rooms, washrooms, lunchrooms, and a seating capacity for 38. And we have designed it in such a way, the 38 that's the regular seating capacity for the post office. But we know that at the early in the month, when lots of the elderly folks come for their pension, there was an overflow. There was an old shed that was in the yard, and sometimes I would refer to it, and I know Ms. Brown used to get upset with me when I referred to it as a cow pen. But I don't think in this modern day we need to have our elders sitting on the sheds where they were exposed to the elements. So while they have 39 seats in their space, we will schedule our clinics in such a way that on those first week of the month when it's pension, that that clinic will not be will not schedule for that period and that days. So the spillover will be in the building in a very conducive and safe space. And importantly to note that the building will have 2 elevators. So we don't have to tread those long stairs. And additional services at this facility will be X-ray, we never had it, and these are very new services, X-ray, ultrasound, ECG. We have an asthma bay. I met a mother early, and this is the first thing she asked me if we have an asthma bay, because she said when she goes to Georgetown Hospital, there is a wait in the asthma bay because the volume of patients that go there who require care for asthma. So there will be an asthma bay here, there will be physiotherapy, spirometry, diet and nutrition, diabetic care, including retinopathy. There will be a dental suite and a full range of primary health care services where we are ensuring that health care remains accessible and comprehensive and efficient. And I also want to say that during this weekend we signed a contract for the EMR. So a lot of these services, if you take an X-ray image here, it will load into the PACS. The radiologists at Georgetown Hospital can see those images, they can develop reports with. If you take off your blood sample, we didn't want to put a lab into this facility because it might be a redundant of our service, but we will have a proper logistic method in place to transport the sample to Georgetown Hospital, and those lab results will be available electronically to the facilities. Actually, they are already available electronically to the facility, but this will now be integrated to the whole big EMR system that we are working on. And I must say that we did several assessments, interviews, observations, and survey at the Kitty Health Center. I personally, some morning when I go to work, a lot of people know that I go to work at 5 o'clock some mornings. So I will stop there and observe. And I told them one time I saw a lady that lived 7 houses, I counted, 7 houses from Kitty Health Center, but she went with a car. So I said if she could go to Kitty Health Center in the car, we don't see a challenge here. She come to Campbellville Health Center, which is just about 3 minutes more up the road. So we went through there all, we checked it, and I guess back in the days when all these health centers and post office and services were built in close proximity to those catchment areas, because those days we didn't have much of a transportation that we do, an accessibility of transportation like we do now. So we did all those tests. We didn't just decided that we ad hocly removing the post office. This project, it was a tender. It was a public tender. There were 16 bidders, and the contractor that was selling is BM Property Management Investment Inc. And the supervisory consultant is Innovative Engineering Consulting Service. The project sum is $811,811,890. So let me repeat that, $831 million. I think we deserve a round of applause for those sorts of investment. The project will be a 12 months duration, and we are hoping that it will be completed way before that. Such a transformation endeavors is never accomplished alone. It takes a vision and from the top. And I would like to extend my sincere gratitude to everyone who played a role in bringing us to this moment. Our president, Mr. Mark Phillips, we had to reach out to him with retrospect to the post office, the board of the Georgetown Hospital, the Minister of Health, the Minister of Finance, the Postmaster General and her staff, the staff of Georgetown Hospital, the architects, construction team, and most importantly, the residents of the community. Your support, vision, and determination have made this dream a reality. Let us also recognize dedicated healthcare professionals who will one day work within these walls. Your experts and dedication will be the heartbeat of this polyclinic, ensuring that each patient who walks through these doors is met with excellent care and passionate and compassionate touch. As we break ground today, we are not just constructing a building, we are building a healthier future. Let this ceremony serve as a reminder of our shared responsibility to uplift and care for one another. Together, we are paving the way for a stronger, healthier, and a more connected community. Thank you for being here to celebrate this moment. I look forward to the day we will gather again to cut the ribbon and see this vision brought to light. Thank you, and may God bless us all.
Thank you, Mr. Ramran, and I know that you would have thanked everyone here, including your leaders, Dr. Frank Anthony and President Ali, but on behalf of the Georgetown Public Hospital, and I know that all of the staff from the Georgetown Public Hospital here this morning would like to say thank you, Mr. Ramran, for your leadership and vision at the Georgetown Public Hospital. Mr. Ramran has played and continues to play a pivotal role in the expansion and modernization of our healthcare system, ensuring better medical services for the communities we serve. At this time, I would like to invite Dr. Kanta Prashad, the dedicated doctor in charge of the Campbellville Health Center. Dr. Prashad has been at the forefront of community health, ensuring quality care for residents in Campbellville.
Thank you very much, Mr. Peters.
His Excellency, Dr. Mohammed Irfan Ali, Minister of Health, Honorable Dr. Frank Anthony, Chief Executive Officer, Mr. Ravi Rambaran, Honorable Ministers, distinguished dignitaries, esteemed colleagues, and ladies and gentlemen, good morning. As you will see in front of us here, this beautiful building, all right? And as you can see, it's a two-story flat, all right? It features a picture of what the Campbellville Polyclinic would look like. This marks a significant advancement in patient care, medical education, and specialized services. This transition will address existing infrastructure challenges. As our CEO just pointed out, we had a lot of challenges, and expand healthcare delivery in a more efficient, patient-centered manner. The new facility will offer structurally sound environment with better ventilation, lighting, and space, ensuring a safer and more comfortable setting for patients and healthcare providers. This upgrade will enhance infection control and reduce overcrowding, ultimately improving overall patient experience. With increased space, the center will accommodate a growing patient population more effectively. Additional consultation rooms and specialized areas will streamline patient flow, reducing waiting times and congestion, leading to more efficient service delivery. The new facility will strengthen maternal and child health care by providing improved prenatal, postnatal, and pediatric services, ultimately fostering better health outcomes for mothers and infants. As a designated care and treatment center, the facility will provide enhanced HIV care, treatment, and counseling services. Importantly, we must note all services will be integrated, and this will eliminate stigma and discrimination. Also, and this will ensure that all patients receive care with dignity and confidentiality. The establishment of a dedicated asthma bay will improve the management of acute asthma cases, ensuring quicker emergency responses and long-term care strategies. Additionally, the new facility will offer expanded specialized services, reducing the need for referrals and providing comprehensive care within the center. Chronic disease management programs will also become more structured, improving the continuity of care for patients with conditions such as diabetes and hypertension. As a teaching center for health professionals, the new facility will offer dedicated training areas and improve infrastructure for hands-on learning. These upgrades will enhance interactive education and skill building for family medicine residents, medical officers, medical interns, nurses, and other healthcare professionals, ensuring the continuous development of clinical expertise. A modern and well-equipped working environment will reduce stress and burnout among our healthcare providers. Improved resources and streamlined workflows will enhance staff efficiencies, job satisfaction, and overall service delivery. With its state-of-the-art infrastructure and expanded services, the new facility will instill greater confidence in the healthcare system, encouraging higher patient engagement in preventive and routine care. The transition to this modern facility represents a major milestone in healthcare delivery, ensuring that patients receive quicker, safer, and more comprehensive health care. This upgrade not only enhances clinical services, but also strengthens medical education, staff efficiency, and community health outcomes, while promoting inclusivity and eliminating stigma in healthcare delivery. Your Excellency, we thank you for your leadership and vision in making this project a reality. The investment in healthcare is an investment in our future, one that will save lives and strengthen our healthcare system for a generation to come. Thank you.
Thank you, very much, Dr. Prashad. We will now have remarks from Dr. Roberta Martin, the doctor in charge of the Kitty Health Center. Dr. Martin's experience and commitment to public health have been instrumental in serving the community of Kitty.
All protocols observed. A pleasant good morning to everyone in attendance. For many years, Kitty Health Center has been the cornerstone of health care to communities like Kitty, Newtown, Sobrianville, Bel Air Gardens, Alberton, Queenstown, North Commingsburg, and Kingston, providing essential services to many. Our dedicated staff work tirelessly to ensure high quality care is given to everyone who walks through our door. Our building has served us well, but over time it has become clear that it can no longer meet the demands in providing the level of care our patients deserve. To ensure continued high quality health care services, we will be merging with Campbellville Health Center, the Modern Campbellville Polyclinic. This decision was not made lightly, but this step is to improve healthcare delivery and to provide better facilities for both patients and staff. We understand that change can be difficult, and some may feel uncertain about what this means for them. I want to reassure our patients from the Kitty Health Center that our essential services will continue at our new location. In fact, patients will benefit from improved services. And you've heard it from the CEO, you've heard it from Dr. Prashad. The new center will have upgraded infrastructure, better medical equipment, a more efficient setup. It's a polyclinic, so that means we'll be running multiple clinics every day. So we have chronic disease clinic, our antenatal clinics, our child health clinic, and they'll be all running together. And it will provide a wide range of healthcare services, which includes x-rays, ECG, ultrasound, dental services. We heard about the asthma bay and many other services. I want to take this moment to express my deepest gratitude to the staff of Kitty Health Center, patients, and community members who have made this health center what it is today. Your trust and support have been invaluable, and we look forward to continuing our journey together at our new location. I thank all our stakeholders, and yes, we look forward to this new journey. Thank you very much.
Thank you very much, Dr. Martin. I would now like to invite a young, talented Guyanese artist to entertain us this morning. Please help me welcome Mr. Abel Stokes.
Good morning, everyone. So, I'm about to do a song by a Guyanese artist. His name is Adrian Dutcher. Now, like always when I sing a song, I have you sing the song with me. So this song is called I Am a Guyanese, and everyone should know this song. So guess what you're going to do for me this morning? You're going to just say the word Guyanese. Simple and easy. I'm going to say, I am a, don't matter where I be, I am a, oh my gosh, lovely. Hey, 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 it's who I am, it's who I am, hey, 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 y'all ready? It's who I am a, no matter where I be, I am Thank you. It no matter where I be, I'm proud to still be me, and I'll always represent. I'm always dying. I represent overseas, never deny the pioneers. In the morning, I represent. In the evening, I represent. In the day, in the night, I tell you everywhere I go. My flag, my GT flag. Let's go. I am no matter where I be. I am no matter where I be. Six away in this country, six away in harmony, six away, six away, six away, six away. In every party I have been, inside the defect I have been, country people overseas, never deny your agonies. In the morning, in the evening, in the day, in the night, anywhere I go I got my flag, my GT flag, 'cause I am no matter where I be, I am no matter where I be, I am Thank you so much.
Mr. Stokes, should you need a backup singer at any future events, I am available. Our next speaker is Mr. Stephen Jacobs, Councilor of the Kitty constituency, who will share his insights on this new healthcare initiative and its impact on the community.
Thank you very much, Ms. Master Ceremonies. His Excellency, His Excellency President of the Cooperative Republic of Guyana, Dr. Mohamed Irfan Ali, Honorable Minister of Culture and Sports, Mr. Charles Ramson Jr., Honorable Minister of Health, Dr. Frank Anthony, Honorable Minister of Human Services and Social Security, Dr. India Prasad, fellow councillors, special mention to my colleague councillor of Kitty constituency, Councillor Rudolph Dial, special invitees, administrators of the Guyana Public Hospital, Georgian Public Hospital, and also, most importantly, members of the Kitty, Campbellville, and surrounding areas. A special good morning to you. Let me from the outset congratulate the People's Progressive Party civic government on yet another step to realizing world-class health care. And the government's unwavering commitment to development in this country should not be taken lightly. I'm pretty sure over the last couple of years, you've seen salt turning after salt turning. You've seen community outreaches or consultations, or you would have seen His Excellency's visit in the wee hours of the morning to work sites. And that is something that we should never take lightly. And for that this morning, I'd like you to put your hands together for this government and His Excellency, for the Chairman what they're doing. It is very, very important that we don't take for granted what this modern polyclinic would mean for Kitty and also Campbellville. Mr. Robbie in his speech mentioned extensively about some of the challenges that persons would have experienced on this, at the two facilities. But yet we are here today for a sort turning of a new facility, a new modern facility that will not only provide increased services, but efficiency, better doctor-patient relationships, and it also relieves some of the burden at our more premier hospital. Also something that captured my attention during Mr. Robbie's presentation he mentioned that the Ministry of Health took over healthcare centers across Georgetown. But one of the things that he failed to mention, it was from who? I told my colleagues that I would not do this morning, but it's very, very important that we understand where we're coming from and where we're going, to put context to every single situation that might face us. You took it over from an AP&U-led council. And one of the things that this government did during our local government elections is to put in place active councillors who are on the ground every day. And for that reason, I can ask my councillors to stand who are here. Please stand. Let people recognize the work that we continuously do. Thank you. Continuously do on a daily basis. And for that, I want to thank the government for supporting us as we continue to advocate for better facilities around our constituency, better infrastructure. And I'm pretty sure you're seeing it extensively across Georgetown. While I mentioned about taking over healthcare services, there are a number of other aspects that the government basically took over. You speak about drainage, you talk about the government around Georgetown. You speak about community grounds, Mr. Charles Ramsey is there on the ground. This is what this government is. It's people-centered. Roads, thank you, Charles. The roads right across Georgetown. And it will continue. And I'm pretty sure His Excellency will say that this is just the beginning of something big and greater to come. You've also seen recently a partnership with King's Foundation to restore Georgetown. And this is something that everyone should play a part in, especially when the consultations will start, on what and how you would want to see your community. I think that is very, very important. So, I grew up just a stone's throw away from here in Kitty. I know many of you might know me from being hit for a 6 or a 4. Or bowling straight spin, according to Mr. Charles Ramsey. Right. I wouldn't attack him here to say that I had played for the Amazon Warriors, and he did, but I'll give him his prop. I see he can shoot some balls, basketball. So I commend you for that. But it's very, very important, you know, like I mentioned, I grew up in Kitty. And, you know, the health center posed some challenges over the year. So this definitely comes at a significant time when we're in the transformation period. And His Excellency, on behalf of our constituents in Kitty and also Campbellville, I'd like to thank you and the government very much for this. Something that I also think is very, very important is that while this government is on an ambitious mission, and while we develop this modern pitch, and I might say things in cricketing terms because I played cricket for a number of years, we have the experienced coordinators led by His Excellency. And this pitch, we must make sure that we embody the development and show love and appreciation that everything that is unfolding in front of us right now. And again, for that, I thank His Excellency and the government. I wish the contractors well. I hope you have an injury-free time building this beautiful facility. Thank you very much.
Thank you very much, Mr. Jacobs, for your remarks and your cricket commentary. We now invite Mr. Pagu Singh, Councilor of the Campbellville constituency, to offer his perspective on this major healthcare development.
His Excellency Dr. Mohammed Irfan Ali, President of the Corporate Republic of Guyana, Minister of Health Dr. Frank Anthony, other ministers, CEO, Georgetown Public Hospital, members of the Diplomatic Corps, members of the Cabinet, welcome and good morning. Today we stand on the threshold of progress. This salt-turning ceremony marks the beginning of something truly transformative. The structure of this modern Campbellville Polyclinic healthcare is the foundation of the thriving society. A community cannot progress if its people are unwell. This facility therefore serves to present our unwavering commitment to the health and well-being of our people. For years, the residents of Campbellville and surrounding communities have longed for the improved healthcare service closer to home. We have listened to your complaint and concern, and today we are taking action. This project is not just an investment in infrastructure, it is an investment in the people. It reflects our government's commitment to strengthening the healthcare system, expanding access to services, and improve the quality of life of all citizens. As we turn this sod today, let us remember that this is only the beginning. Let us work together with the government officials, healthcare professionals, community members, and private sector partners to ensure that this facility fulfills its promise. May this polyclinic stand as a beacon of hope, a pillar of service, and a symbol of our shared vision for a healthier, stronger Guyana. Before I take my leave, I would like to commend the government of Guyana, especially the One Guyana initiative, for the continuous progress and development of our country, not only in Campbellville, but all over this country. For example, in my area here, we see the new Conversation Street 4-way. We see new facilities, lights right here. Right behind me, there is a brand new basketball court being constructed right now as we speak. A lot of roads resurfacing almost all over the area. Drainage, irrigation, bridges, etc. So once again, thank you, the government of Guyana, especially the president of Guyana. Thank you.
Thank you, Mr. Singh. It is now my honor to welcome the Minister of Health, Dr. Frank Anthony, to address this distinguished gathering. Under his leadership, Guyana's healthcare sector has seen tremendous progress and improvement.
His Excellency Dr. Mohammed Irfan Ali, President of our dear country, my colleague ministers in the Cabinet, Charles and Vinya, CEO of the hospital, Georgetown Hospital, the other directors who are here, Dr. Rambaran, and all the other directors of the hospital, the councillors, the Georgetown City Council, who are all here with us and have been doing fabulous work in and around the city, the Postmaster General and her staff, and all the residents of Kitty and Campbellville who are here. I think listening to the presentations this morning, you have a fair idea of what this center would do. And I just want to pick up from where Stephen left off, because I think it's very important to understand that. In the city, in and around the city, there are about 13 health facilities. And technically, these health facilities are supposed to be run by the city of Georgetown. Unfortunately, there is only one health facility that the city of Georgetown has a very minor input in, and that is the Dorothy Bailey Center. All the rest, the Ministry of Health has been providing the service at all of them. And if we had left them under the stewardship of the City Council, that is led by APNU and AFC, unfortunately, the care that would have been given to the residents of Georgetown would have been suboptimal. So while the rest of the country would have been getting better care, in Georgetown, it would have been subpar. And in every one of these facilities, whether it's at Agricola, East La Penitence, David Rose, Alberton, Lodge, number 1 dispensary, Northeast La Penitence, Sophia, Dorothy Bailey, Campbellville Industry, Kitty, Festival City. Every single one of them, over the last 3 years, we would have done something to improve the conditions of these facilities. For example, in the number 1 dispensary, right now we are doing over the entire facility, and the government is expending $180 million to do back that facility for the people in that area. Dorothy Bailey, this year we are upgrading Dorothy Bailey, which the city has, I think, 1 person who is at Dorothy Bailey. And they're supposed to be providing care there. But the Ministry of Health, the government of Guyana, is going to spend $55 million to upgrade that facility. And in Festival City, we now, as Robbie said, we have given it for the Georgetown Hospital to manage it. And we spent $294 million to upgrade that facility, bring it to the level that it's that right now it's at. Because I remember when we walked through there were many services that could not have been delivered because of the way that the thing was constructed. And while they wanted to do x-rays and things like that there, they didn't make allowance for the x-rays. So we had to build a completely new section to put in x-rays and things like that. And now it's under the management of the Georgetown Public Hospital, where the people in that part of the city is getting excellent care. I thought I would start with that because I want to give you that picture. But this government, we manage close to 380 different facilities across the country. And over the last couple of years, we have spent a lot of time upgrading all of these facilities. So whether it's a health post or a health center, we have upgraded them all to make sure that patients coming to us would get better conditions where they can wait and where they can get their service. Every single facility in this country we have upgraded. And just maybe for context, during I know Stephen said you didn't want to go there, right? But you know, the last 5 years of the APNU AFC, they didn't build a hospital. They didn't build a health center. In the last 3 years, because the first 2, we would have spent managing COVID. The first 2 years of the PPP's current term, we would have spent managing COVID. So in 3 years, this government would have built 25 health centers and health posts across this country, brand new. And when the president speaks about this world-class healthcare system, that he would like the Guyanese population to enjoy, it's not just words. We have started working on 14 different hospitals across this country, and this year we'll have 6 of them being completed and put into operation. So hospitals, we can look at what we do in terms of curative care. But what is the intention of these facilities is to look at more preventative care. People must be able to come in and get preventative care service. I know our population don't like to come for checkups, but we need to foster that culture of checkups, because when you come and you get your checkup, if something is wrong, we pick it up early and we'll be able to address it so that you don't develop complications. And that is why the government has a very strong program now in community health. At every one of our community facility or health center or health posts, we want to make sure that we can deliver good community health. And we have come up with a package of about 115 different interventions that we'll be able to offer uniformly across all our health centers and health posts in this country. Those interventions include being able to diagnose a number of infectious diseases and being able to offer those treatments right at the health facility. We also have discussed, because one of the big challenges that we have is with chronic non-communicable diseases. So things like heart disease, that's a big problem in our population. Hypertension, heart disease, it's a big problem. And we also have things like diabetes, it's a big problem. We also have different types of cancers that we have to manage. And so part of the package of service that we are delivering is to ensure that we can screen for different types of heart problems. And if we find that there's an issue, we'll be able to manage you first at the health center. And if they cannot do it at the health center, to escalate it to the next level. So at the hospital, or to refer you to the Georgetown Hospital. So we have a clear continuum of care. So from seeing you first, right up to if you need to have a particular intervention. And we are making sure that as part of this continuum, we have all of the interventions, the necessary interventions, so that people can stay healthy. In terms of diabetes, this is one of the challenges that we have in our country. And again, we are not only stopping to try to diagnose people who are diabetic. We want now to screen people, those who are pre-diabetic. And if we find you when you're pre-diabetic, we can work with you to delay the onset of diabetes so that that's not necessarily the trajectory that you have to go. If you take certain interventions and do certain things, we'll be able to delay that process, which means that you will stay healthier, and even if you become diabetic, then we'll be able to manage you properly. So this is the direction of the government. We want to make sure that these services are delivered not just at one health center, two health centers, but uniformly across the country. And we have one standard across the country. Last year, one of the things that we did was to work with Mount Sinai, and most of you will know that name. They're one of the first class, or one of the world's foremost medical facilities. And they've been working in Guyana for the last 3 years. And so they have worked with us last year to develop diabetes guidelines. They have worked with us to develop cardiovascular guidelines. We have trained our physicians, and we have delivered that level of service across our health centers. Then when we look at cancer, one of the things that we know is that among women, we have breast cancer and cervical cancer being the more prevalent. And among men is prostate cancer. But up to a couple of years ago, we talk about these things. We have seen the figures, but we're not doing anything per se. we didn't have the right interventions to prevent these things from happening, to screening people, and if we find people who had these cancers, then to do something about it. So people were being diagnosed when it was very late, and at that time, the outcome was basically a very bad prognosis. We have changed that paradigm. What we are doing now, we are screening more people. Last year, for example, for prostate cancer, through our community health program, we were able to screen 13,000 men across this country. And while we screened them, there were about 3,000 who had elevated PSAs. And of those, we were able to do their biopsies. And when we did the biopsies, we found that about 200 of them already had signs of prostate cancer. But because we were able to catch it early, all of those persons are now in treatment. And that's what the government is about. Finding things, fixing it, so that our population can remain healthy. And when we look at cervical cancer, for example, it's all preventable. We have the HPV vaccine that is available in our country. And up to a couple of years ago, the coverage of that vaccine was at 17%. We have increased that now to 54%, and our intention is to get it up to 90% across the country for persons between the ages of 9 and 15. So we are on our way getting there. But we need your collaboration, your cooperation, so that we can get our population to understand how important these things are. This facility that we will have here, we are bringing two facilities together, and we will have a modern facility. So think about that. I was telling Dr. Prasad just now, you know, some mornings I would drive past here, and I would go around there to get to the ministry. Because of the traffic, I usually come through these areas. And every time I pass here and I see people out in front by the gate, waiting to go in, I always thought that this thing, we need to fix it. And we got to do it urgently, because this is not the kind of facility that we want in a modern Guyana. And so we worked very hard. And I remember visiting the existing facility. And one day I went there with Compton. I walked through the facility, and it was leaking. So rainfall, it leaks. And every time we were spending a whole set of money trying to fix this, trying to fix that. Every year we were budgeting sums of money. So the place was really hodgepodge. You had a little piece here, a little piece there, you know, leaking. And I thought, this can't be the way that we want a modern facility. And that was why we placed so much emphasis on doing this, and to make sure that we now would have a modern facility. So I want to congratulate everybody who put their heads and hands together to make this happen, especially the people at the Georgetown Public Hospital. You should give them a big round of applause. But what are the things we want to have here? You heard some of the things that we'll be doing. But we want this entire area, all the vaccinations that we'll be giving, we want to make sure that every child would get those vaccinations right here. We want every child who we are screening through our school health program, that if they have to be referred, that they will come here and get some of those services done. So whether it's eye screening, whether it's screening for your hearing, whether it's the dental checkups that you need, every child would be able to get that here. And this project here, is envisaged to take 12 months. Before 12 months, we are now putting in the electronic health records at the Georgetown Hospital. And one of the things that we will deploy is a health app. So you will be able to download that app on your smartphone, and you don't have to now come in and go to the hospital and sit down there and wait to see the doctor. When we deploy that app, you would set what time that you want to make this appointment, and you'll make your appointment. They would then be able to respond to you, and you'll work out your time. So when you go there, you will be able to be seen within 10 to 15 minutes. That's what we're working on. And so this would first be deployed at the Georgetown Hospital in another couple of months. And so by the time this facility is finished constructing, that would be the new norm. You will be able to use your app and make your appointments and come in and get your service. In addition to that, your health records would now be on your smartphone. And if you do an x-ray here at this facility, it would also be on your phone. If you have to get a prescription, you will get an e-prescription so everything would be on your phone. And in that way, we'll have a better system, more efficient, we'll be able to track things better and manage our patients in a better way. So not only are we going to give you a modern facility, but we'll give you a modern way in which to make your appointments and in a very efficient way in making your appointments, coming in to see your doctors or other health providers. So this is when we talk about this modern way of doing healthcare, this is what we are talking about. And this is not some imaginary thing. It is happening as we speak, because this government, under our president, has put the resources to make sure that these things happen. There are many other things that we are doing in community health, but it would take a long time to go through all of them, because we can talk about every one of the 115 interventions that we are doing, but that would take a long time. But I want to wish you well. I'm sure that once this is commissioned, that the services that we'll provide, it will be excellent service, and we'll continue to work with the other centers in Georgetown as we upgrade them and make them better. And even if the APNU and AFC does not want to take on their responsibility, this PPPC government would make sure that good quality health care is delivered to all the citizens of our country. Thank you very much.
Thank you very much, Minister. I am sure the residents of the Kiki and the Campbellville community here this morning are excited about this new project. As we continue along our program, please allow me to invite the Pangrove Steel Band to continue serenading us with some good steel pan music this morning. and gentlemen, it is with great honor that I welcome our esteemed head of state, His Excellency Dr. Mohammed Irfan Ali. His Excellency has continuously championed national development, with healthcare remaining a top priority. Let us now warmly welcome President Ali for the feature address.
Thank you very much. Please have your seats. First of all, allow me to congratulate all of you for your presence here this morning, because it tells a story that collectively all of us want what is best for our community and what is best for our country. So put your hands together for yourselves. In the end, what matters is the quality of life that your families, members of your community, and the people of Guyana enjoy. And that quality of life is directly related to the quality of policies that are created for every single sector. And the quality of policies are directly related to the quality of leadership and quality of government that develop those policies. All of it must go seamlessly together if we are to create an environment and if we are to create the circumstances through which development and advancement would take place. You know, I'm particularly very proud of, all the speakers speak about the president, the ministers, the cabinet, the leadership of the hospital, and I want to acknowledge too Dr. Berry, who is here, former Minister of Health, who did tremendously well also in supporting the healthcare system. But I want to acknowledge the champions of development who quietly, unassumingly, and steadily go on the ground to communities and to ensure that they stay connected every day to the issues, challenges, successes of all that we do. And today we have a sample of those persons in our councillors at the Georgetown City Council. And I would ask them to stand also. And when you look at this sample of our councillors, you see something that we celebrate. And one of the great things about whatever the teams that I like to lead is the sense of family and sense of unison in what we do. And if you look at this team, you will see youth, experience, you will see the beautiful nature of Guyana reflected. And that is what the People's Progressive Party prides itself on. Putting together teams of people, we don't have this. Putting together teams of people who would believe, have the credentials, the potential, and commitment to drive the development of our country. What might be astonishing to you is that many of the persons on this team were not, as you would normally hear, I am born PPP or I'm born this or born that. Many of them were members of the Guyanese family. And the last 4.5 years came to give their service with a team that they thought reflect priorities, vision, and direction in which Guyana must go. And I want to thank them for embracing that challenge. But not just embracing that challenge, but working in a conscientious way in ensuring that we're successful in what we want to deliver. It is painful when you're very connected to the leadership at every level and on the ground, because you have to be able to respond to thousands of text messages, all of which will be representing different interests and will be representing different challenges and issues. it is a early morning joy that I find in the job. So I want to acknowledge these young people. The changes that we're seeing in Guyana, and Marcia is here, and she finds herself a new toy these days. And that is to use AI to show what is AI interpretation on what this street would look like, Georgetown would look like. And every time she brings the new image to me, I say, that wasn't the old image. But that is because of the speed of change and speed of transformation that is taking place. And this transformation, as Jacob said, is the first installment. And that is the basic infrastructure that is required to drive the growth that exists today. Many people see the drains and the roads that we're putting in place. And you're also seeing that those roads that never existed there before are already crowded. And then you ask yourself, how did we survive without that road? But that is the nature of development. And we are moving at such a rapid pace that we have to build whilst we plan. Otherwise, the type of transformation and change that you see could not have occurred. Frank spoke about doing this in such a short time. Many people, because of what they see and the results they've seen in the last 4 years, forget that we actually spent 2 years in COVID. 2 years when everything we wanted to do was curtailed because of COVID. Many people also fail to realize we have done this with the same bureaucracy. We have not expanded the bureaucracy, which would have meant that people would have been working at a more efficient pace and our working hours would have been much longer. And this can only occur if at every level of government we make the necessary adjustment and changes. There's I think the most fearful conversation cabinet members want to have with me is to go and leave. Because in our space at cabinet, that is a luxury at this point in time. But it is an essential luxury if we are to accomplish the results that we are seeing now and the results that will unfold itself before you in the coming months and years. Whilst we are celebrating more than 115 facilities across the country, 12 new major facilities in healthcare, and just in healthcare, we are already planning the new oncology center. We are already planning with international partners the management support and specialized diagnostic facility to meet regional and global health needs. Because we have a clear vision and a clear understanding as to what must constitute world-class healthcare. And under our e-health initiative and the electronic platform that we're building to support healthcare, Frank spoke of one initiative where we will have on your mobile phone the ability to schedule an appointment. And I want you to pay attention. In many developed economies today, whilst we are building these facilities, there are closing down clinics and polyclinics because they don't have the human resources to manage the clinics, and they're cutting budget and they're closing these clinics down. Only 2 nights ago on CNN, you will have seen one such story. Now, this platform that Frank spoke about will do much more than scheduling. It will have reminders for your appointments. Now, we can easily say, why remind people about their appointments and give yourself a headache in the healthcare system? But we want you to have that qualitative change in your healthcare. So we want to remind you about taking care of your health. So the app will have reminders. It will have healthcare education, healthcare announcement that are key and critical to the safety of you and your families. We have an automated update system on your medication. So every time you come in for your medication, it is placed in the system and it would alert you that it's time for your replenishment. Those are all systems that we are building in this platform. But this smart device would not only be for healthcare. We are working now on the implementation of the electronic payment platform, the mobile payment platform, where you can be in the mining community, one of the deepest mining community, and you can make a payment for a part in Georgetown through your mobile phone, where you can sit in your home and pay all your bills from your mobile phone. And then that will be connected to Vindi Ministry on all the other services that the Ministry of Human Services offers. So this payment platform would take away a lot of the stress and the productive time you lose to transact business. Just imagine if you have to come and wait an hour at the clinic and you can spend 45 minutes at home with your children doing homework, knowing that your appointment time is not there as yet. That is the added value, the added productivity, the productive use of time that comes with this facility. We also ask every single Guyanese, whether you're a public servant, member of the joint services, we said, listen, we are launching the nearshoring training and job program. Register on it, go through the 6-month training, get the certification, and you will add additional income in your pocket, working 2-3 hours, maybe in the evening from home. That's the digital platform that we're building. You know, a diplomat told me, maybe a month ago, that they had to go to Georgetown Hospital for medical needs. They went in there, didn't call anyone. Within 30 minutes they were seen. They had a series of tests done, results efficiently delivered. They had a digital x-ray done, results delivered and read. And at the end of it, the diplomat asked for the bill. And he was stunned that it was no cost. And he said to me, at the minimum, the country he came from, that would have been $3,500 US. $3,500 US. take these things for granted. When we speak about qualitative improvement, we need to look beyond the narrowness of our vision sometimes and take the totality of the transformation and development into consideration. Because trust me, the young people now, young Robbie, they are growing up in a different Ghana. They're growing up in a Ghana where they will see this as the baseline. So they will be holding someone down the road at a very different standard. Dr. Cummings will tell you, he knew what the baseline was as a medical doctor. Just imagine, from facilities that prior to 2021 would have seen 200, 300 persons every month, now seeing 5,000 persons every month. These are things that go unnoticed. The surgeries at the regional hospitals. Are there challenges? Of course there are challenges. Imagine life without challenges. Are there cracks? Of course there are cracks. Is there inefficiency? Of course there is still some inefficiency in the system. But amidst it all, the much larger story is of success, development, and transformation. Let me spend 2 minutes more on this patient management information system. So, on an average, if you are moving from this clinic to Georgetown Hospital, you would have had to wait at least 45 minutes for them to prepare all the paperwork. Otherwise, you will be going there and the doctors will be waiting for the paperwork. Instantaneously now, you just move and the paperwork electronically will be available for any doctor at that hospital under the new patient management information system. You don't have to walk around with the x-rays or the file or the folder. And we launch the health voucher because we want you to go and do the test so we can input it in the system so that the doctors don't have to ask you a ton of questions when you get there. With AI, it will take your history, it will take your most recent complaint, and it will help us to triage the patient. So before you get to the hospital, many of you complain that somebody is deciding who is an emergency and who is not an emergency. Well, the AI system will triage with human supervision. So there is checks and balances. That is where we're taking this healthcare system. When we sit and think about the healthcare system, people are amazed. Internationally, our healthcare system is being celebrated, the development and advancement we're making. Our education system is being celebrated. Our financial system is being celebrated. Our development model up to recently has been evaluated and assessed by IMF and is celebrated. Our policies on poverty is being celebrated. And sadly, there is some here who see no reason for celebration. Now you have to be very special to read through a budget and come up with an assessment that the budget does not address poverty because you don't see the word poverty. Well, that requires some special skills. But that is the quality of analysis that the alternative is presenting. I'm happy that they said that, because it gives you a full understanding of the caliber of policymakers, or want to be policymakers. Yeah. These things don't happen by accident. These things occur with careful planning, with full understanding of what is required. Look at sports, for example. It's not about, our sports program is not about building grounds and putting in lights. It's about the development of a sport economy. And by the way, let us all put our hands together for the Golden Jaguars as they move one step closer for qualification for the World Cup. The successes that we're enjoying in sports is not accidental. Today, we're having discussions with major clubs on creating their high performance location here in Guyana. We are building these facilities and linking them to healthier lifestyle, the higher quality life, the better community service. You can now come to the health center in a safe environment. It's creating hubs, developmental hubs. And even our concept of policing is changing. Because we want community orientation around the policing. That is why you're seeing you're now investing in small containerized type offices for the police. The sense of presence and sense of community. Integrating all of the development together. I said 2 minutes on this electronic platform. One more point. All of these polyclinics and clinics will be linked on a telemedicine platform that is supported by doctors here and doctors in our partnering institution, India, the US. So we may have 5 radiologists in the country, but we will have access to 25. All of that will change the technology. And we are adopting the best of as we develop this healthcare system. Now, you will notice this facility is called a polyclinic. And you would want to ask, why is it a polyclinic and not a clinic? there are 5 things about a polyclinic that we must know. One is that it allows for early and accurate disease detection. It supports timely intervention that supports saving lives. It is an important part of improved patient outcome. It is an essential part in information, in informed decision making. And I just tell you how the decision making will be informed by data and information. And of course, the economic value it brings. Because if we have early diagnostics, we can have early intervention. Early intervention can lead to less critical care. Less critical care save money for the economy. Save money for families. If you're diagnosed very early with diabetes and you're being treated and you stay on your treatment, your long-term expenditure for care, critical care for diabetes, will be reduced substantially. So there's an economic value to that too. So what a beautiful day this is. A day of progress. A day when we take another bold step forward in revolutionizing healthcare in Ghana. This morning we are not just breaking ground, we are breaking barriers. We are not just putting up walls, we are tearing down obstacles to quality healthcare. We are not just stirring the sod, we are constructing a better and stronger future for all. And I don't say that lightly, because what we are doing here today is more than just constructing a building. What we are doing today is making and fulfilling a promise. A promise to the people of Campbellville and Kitty and surrounding areas, and to every citizen of this country. A promise that when they need care, they will receive it. A promise that health care is a right, and I will say further, a birthright. We are building a healthcare system that takes care of you from cradle, and we all will have to go to the grave. A system that is there when you take your first breath and when the Lord calls you upon your last breath. From newborn checkups to elder care, from routine screenings to life-saving treatments, we are ensuring that every Guyanese has access to the best possible care, not just at some stages of life, but at every stage of life. My friends, what we are witnessing here is not just an expansion of services, it is transformation. We are changing the game. We are bringing a new era of healthcare, one where access is within easy reach. Diagnosis is swifter. Treatment is more effective. And outcomes are better for all Guyanese. This is not just another clinic. This is a revolution. Now, many of you, as I said, may be asking, why is a polyclinic? And what is a polyclinic? How is it different from a regular health clinic? Well, let me tell you, health clinics provide some care. Polyclinics take it to the next level. Health clinics provide outpatient services, essential services like vaccination, maternal care, and basic treatment. And they do a great polyclinics. They prevent hospital overcrowding. Very importantly. That's the kind of healthcare system we're building. A system that ensures the right care at the right time, at the right place, And by doing that, we reduce the strain on our hospitals, allowing them to focus on critical and emergency care, while our polyclinic handle diagnostics and specialty treatment at the community level. What this means is less waiting, more healing, and better outcomes. But let me be clear, this is not just about building more. It's about building smarter. Healthcare without data is like medicine without diagnosis, ineffective. With the polyclinic and others to follow, we'll develop baseline health data that will help doctors make better, faster, and more accurate diagnosis. We'll create electronic patient records so that when someone walks into a facility, their medical history is readily available, reducing errors, eliminating unnecessary tests, and ensuring continuity of care. No more guesswork, no more mining through cupboards for health cards. Records will be stored electronically. We're aiming for the right care at the right time. And that, my friends, is what true progress looks like. Not just access, excellence. Not just treatment, precision. Not just health care, health transformation. But we're not stopping here. We're starting a process of gradually upgrading our health clinics into polyclinics. That means communities that already have health clinics will soon see improvements. They will see better facilities, more specialized services, improved diagnostic capabilities, and a greater capacity to care for their people. This is not just a step forward, it is a giant leap. And let me just quote the WHO so you can know that we are part of the revolution and adopting the highest standards. This is what the WHO said. Diagnostic services are vital for the prevention, screening, diagnosis, case management, monitoring, and treatment or surveillance of communicable or non-communicable, neglected, tropical, and rare diseases, injuries, and disabilities. Therefore, equitable access to safe, effective, and quality assured diagnostics requires a comprehensive health system approach that addresses all stages of the access value chain. So today, this investment is in keeping with the lofty goal of the WHO and is part of what they describe the access value chain. Polyclinics are the wave of the future, a smarter, more efficient approach to healthcare. They bring more than basic primary health care. They deliver comprehensive specialized care closer to the people. Integrated diagnostics, specialty consultations, and preventive care under one roof. Reduce the burden on hospitals and ensuring faster, more effective treatment. Provide lab tests, imaging services, and access to multiple medical specialists. Ensure better management of chronic conditions and fewer unnecessary hospital visits. It bridges the gap between primary care and hospital treatment and guarantee that Guyanese receive high quality, timely health care right in their communities. Let me give you an example. One of the most celebrated healthcare systems at one time was the Canadian system. I said at one time because it's changed rapidly, not for the better. And you know what was the feature of that system? Strong emphasis on primary health care with quarterly checkups. And you don't see any specialty doctor. You see what they call a family doctor. In the developing world, we will call a general practitioner, general physician, something like that, right? And based on your results, they will tell you go home. And based on your results 3 or 4 days after, they will call you and say, okay, you schedule a specialized checkup with this or that doctor. And if you don't receive a call, then you know that your next checkup is 6 months ahead of you. That is how the effective system works. When this facility is completed, we will staff it with top-notch medical professionals, doctors, nurses, specialists, and technicians, equipped with the skills, training, and expertise needed to provide the highest standard of care to every patient who walks through these doors. The polyclinic will serve a wide catchment area. It will serve thousands of residents who will have access to quality treatment with better results. It will reduce the travel time, increase their productivity time, and enhance their medical care. This, therefore, is not simply an upgrade, it is a revolution in how we deliver care. This is the kind of vision we are bringing to healthcare, a vision where every region, every community, every citizen has access to the kind of medical care that improves lives and saves lives. No one will be left behind. No one forgotten. Now, none of this happens overnight. None of this happens by magic. It happens because we come together, government, medical professionals, community leaders, and every citizen to make it happen. I urge you to watch this process unfold. Hold us accountable. Support this transformation. Engage with the revolution in healthcare, because this is about you, your families, and your future. When we look back years from now, we will see this moment as a turning point. A moment when Guyana decided that it would not settle for a healthcare system that merely gets by. A moment when we committed ourselves to building a system that leads, not just better, the best. A system that ensures that whether you are rich or poor, young or old, you get the best care possible. Not some of the time, but all of the time. So let us go to work. Let's build this polyclinic. Let's revolutionize healthcare in Guyana together. This government is and always will be the government that serves the people. We believe that governance is not about power, it is about responsibility. It is about ensuring that every decision, every policy, every investment is made with the well-being of our citizens in mind. This is why we are here today, breaking ground on a facility that will bring better health care closer to the people who need it most. We are not in the business of making promises. We are in the business of delivering results. Because a government that truly serves its people does not wait for change. It makes change happen. We listen, we act, we care, and we serve. That is the People's Progressive Party civic government. I thank you, and may this effort be blessed with success. Today, your community will add another key and critical infrastructure. You have a responsibility to ensure that this infrastructure will be here for many generations to come. I thank you, and God bless all of you.
much, Mr. President. The latter part of your speech almost made me get up and walk across there to pick up a shovel myself to start building. Thank you all for joining us on this historic day. The Campbellville Polyclinic will serve as a beacon of improved healthcare, benefiting generations to come. We appreciate your support and look forward to the continued development of Guyana's healthcare sector. Before we close, I now invite you to a very special and significant act, the sod turning ceremony for this very promising facility. Join us to my right as we proceed to turn the sod.
Finish the job.
Sorry? Yeah, so we can jump in. Where's your mic? Thank you. Very kind. Very kind. Well, you're very kind. You're very kind. They are finding a very kind man. You have a very beautiful, kind daughter. That's it. So, right here. Okay, sir. Come, sir. It was very important as you know, the region is dealing with a number of challenges. Haiti, for example, we have showed that the momentum of Haiti is not lost, and that the commitment from international partners and the UN system itself, that those commitments are further strengthened, and to have report from Haiti itself on how they see things in relation to the primary objective of getting this fixed and addressing the issue of humanitarian issue and the issue of security. So we had discussions around that. Of course, the Venezuelan incursions or water, that issue, of course, was brought up and discussed. Of course, CARICOM reiterated strong commitment to support Guyana, our sovereignty and territorial integrity. I had the opportunity to update CARICOM on all aspects of the matter, not only in relation to the latest encouragement, but to the complete disregard for the Argyle Declaration from Venezuela. Not only calling on the elections of the UN, as you're aware, the building of that bridge that connects our territory. These are all acts not in keeping with the Argyle Declaration, and that was also discussed. Issues and challenges in trade and transport. As you know, some of the new policy measures can have major impact on the shipping industry, and the regional private sector organization made a presentation to the heads on what they see as some of the challenges. They highlighted some of the areas of concern, and for heads to advance discussions with us. So those were some of the core issues. Of course, we're also updated on numerous elections that will be occurring in the region, and CARICOM steadfast role in ensuring that our region remains on a democratic footing. Well, these are ongoing discussions. But as you know, there was a specific policy that was announced in relation to shipping that would bring cargo, whether originating from China or made or such vessels made in China. One of the big issues now is that these large smaller vessels into the region. So they would transit in the U.S. to tranship. Now, in the policy, once these vessels fall within that area, they will be charged, or there's proposed to be charged. And that, of course, can have effect on the cost of goods coming into the region, the cost of transport coming into the region. And of course, for Guyana, Suriname, when they start Trinidad and Tobago, the assessment on tankers and other vessels moving gas and oil will also have to be made. So as I said, this is a policy that was alluded to. So there are some discussions that will have to occur. So all of these things are key regional issues that we are discussing.
How this will kind of resolve? What would you place to the U.S. on this matter?
Oh, well, we are partners. The U.S. is our partner. The region recognizes that the U.S. is an important partner. And the regional private sector would be having some conversations with the U.S. That is in training. We will also be having conversations with various actors in the U.S. system, Secretary of State, for example, and also we'll be seeking to, the chair of CARICOM will be seeking a meeting with the White House to go through some of these challenges that we may face and to have a better understanding of each other's position as I speak. But as I said, these are policies that are not implemented as yet, but they're out there, and we have to have all the conversations to ensure that we mitigate or minimize the impact of those.
In terms of the Cuban healthcare workers, as we should take a combined 2.5 position on this matter, if so, what it is, and secondly, the media attending the election when it was made.
So, Shabral is trying to go with me. So let me say two things. One is that Guyana will be engaged with the Secretary of State. And in relation to the Cuban workers, I've already made our statement. Guyana position clear. That is, we are employing persons, whether Cuba, India, Nigeria, in our healthcare system. And all of that follows the local laws and national laws. We have also asked the country for any information that would help us to understand the position of the U.S. and to see whether, if there is any breach in relation to our system, that we will endeavor to ensure that those breaches are looked at in accordance with our local law and international law. The region itself has a varied degree of involvement of Cuban health workers. There are some countries that are heavily dependent. But what is clear is that the Cuban health workers are part of the regional healthcare system. And we are faced with an added challenge as a region, and that is the recruitment of our own healthcare professionals because of the English language advantage for the EU healthcare system, the UK healthcare system, the Canadian healthcare system, the US healthcare system. So over the years, we've been investing heavily in training our human resources to meet the needs. And we became active recruitment ground. That's understandable in a global environment. So I think it's a great opportunity for us to expand on the magnitude of the human capital problem we have in the region, in the healthcare system itself, and to find common ground with the U.S.
We're not abandoning.
Well, no, I made it very clear our position to find common ground, and I don't see this. I don't see abandoning Cuba as part of this equation. The equation is not surrounding a country; it's surrounding an issue, and the U.S. is contending that with the information that is before them, they don't believe that the Cuban health brigade system is following the international best practices and laws and so on. So when we listen to you, we'll have a better appreciation for the information that they have also. But listen, my position is we have to have a stable region. A region that follows the rule of law, a region that ensures the core values of democracy, freedom, human rights are all upheld and followed, and a region that seeks to build stronger partnerships. Here in Guyana, the U.S. is a strong, reliable partner of ours, and we want to ensure that that partnership continues to be strengthened and that partnership results in a win-win situation for Guyana, the U.S. and the region. Thank you. I will be happy to give you no, but I'm going to the I will be happy to give you sections. That's only not going. I will be happy to give you. Yeah, sorry.